and East Copper Belt Province brings to you The Lens, a program designed to bring insightful information on economics, mining, education, health, tourism, agriculture, environmental issues, sports, entertainment, current affairs, and many issues affecting the well-being of society.
Welcome to The Lens. I'm your host, Penlop Chansa. On The Lens today, we are looking at drug and substance abuse. Now, drug and substance abuse has been on an increase in the recent past. One particular age group that has been affected are the youths. To help me discuss the drug and substance abuse issue, I have with me in the studio Nancy Maboshe from the Drug Enforcement Commission here in Ndola. Nancy, welcome to The Lens.
Thank you, Madam Penlop.
It's good to have you on the program. Now, Nancy, from the onset, we want to understand what is the mandate of the Drug Enforcement Commission?
Okay, the mandate of the Drug Enforcement Commission is to enforce law on narcotic drugs and psychotropic substances and money laundering for a safe and conducive socio-economic environment. So mainly DEC is there to ensure that the pieces of law that speak to the narcotic drugs and the money laundering, they are adhered to. And in this case, we are talking about Act 35 of 2021 and the Act on the Prohibition and Prevention of Money Laundering.
Okay, now what are some of the duties that you execute in order to accomplish your mandate?
In executing our mandate, DEC has three main departments, and we have the ADOD, which is Anti-Drug Operations Department. The ADOD is a department that has officers that employ strategies of reducing supply of drugs in our society. This is a team of officers that dismantle drug cartels that are existing through issues of investigation and effecting arrests. And apart from the ADOD that strives to reduce supply of drugs, we have the Education and Counseling Department, which employs strategies of reducing demand for drugs. And by reducing demand, this is where we have different duties of trying to reduce the numbers of people indulging in drug and substance abuse, because we believe if we could have less or no people abusing drugs and substances, that would in turn also discourage the suppliers and the producers, because no one wants to sell what has no market. So ECD provides strategies of reducing demand for drugs, and in that department, this is where you find programs such as prevention awareness activities and road shows, drug counseling, drug testing, and even training such as peer education, family and parenting skills training, and even distribution of the ICE materials that we produce to enlighten members of the public on issues relating to drug and substance abuse. Then besides these two, we have the Anti-Money Laundering Investigation Unit, which we call AMDU. These, they investigate financial crimes. These are crimes where people attempt to acquire money or wealth through illegal means or criminal activities. And the Anti-Money Laundering Investigation Unit investigates complaints of that nature to try and create sanity and have the citizens earn their money and wealth through legitimate ways.
Okay, earlier you said you are a law enforcement agency or body. Are citizens abiding by these laws that you are enforcing as DEC?
Okay, so the answer is yes and no, in the sense that we have citizens that are law-abiding, and despite DEC educating people, arresting people, you find that we still continue to record arrests of drug trafficking, drug abuse. So the answer is yes and no. Citizens adhere, while some are not adhering to the law.
Okay, thank you so much, Nancy, for that insightful talk on the Drug Enforcement Commission. Now we have to get into our topic. What is drug and substance abuse?
Drug and substance
For a
abuse.
layperson like Penlock, what is drug and substance abuse?
Okay. Drug and substance abuse can mean a number of things. To begin with, a drug is any chemical substance which, when introduced in the body, alters the normal functioning of the body. And these chemical substances are introduced through different ways. Others, they are injectables, some people sniff, others they are taken orally, others they are smoked. So any chemical substance which, when introduced in the body, alters the normal functioning of the body, that qualifies to be a chemical. And you will discover that when we talk of drugs, these are chemical substances that are in different categories. You'll find that we have three categories: the over-the-counter, the controlled, and the illegal drugs. So when we talk of the over-the-counter, these are drugs which are freely accessed by people without restrictions, but not to mean that we should abuse them. These are drugs which you get to buy even without a prescription, drugs like Panadol, Piriton. And apart from these, we have the controlled drugs, which we sometimes call prescription drugs. These are drugs where there's some restriction. You only use them when a clinician gives you or they prescribe you, and with such drugs, it's against the law to buy without a prescription, and a genuine chemist will not even sell you without a prescription. Then apart from that, we have the illegal drugs. These are chemical substances that are prohibited under Act 35 of 2021, and with such drugs, there's nothing like anyone who will prescribe you to use it. So when we talk of abuse, drug abuse can mean a number of things. To begin with, it would mean abusing any illegal drug, even if it's just tasting. That amounts to drug abuse because the stuff that you are using is prohibited. Then apart from that, self-prescription of prescribed drugs. You find that with prescribed drugs, like I have mentioned, you only use them with a medical backing. So without any medical backing, that's unlawful, and that amounts to abuse. And even the people that get to sell such without people presenting prescription, they are traffickers. That's unlawful. Then apart from self-prescription of drugs and use of illegal drugs, also excess use of drugs, even drugs that can freely be accessed or drugs that you could have been prescribed with. If you begin to overuse them, you start increasing the dosage more than the one that you have been recommended with, that amounts to drug abuse as well. Then when we talk of substances such as alcohol, the drug abuse can also mean underage drinking. Today we have young ones that are indulging in alcohol. That's drug abuse. Then for adults as well, there is also drug abuse which is actually prominent among adults when it comes to alcohol because of it being a legal or social beverage. So with adults, you find that drinking more than the recommended way of drinking, failing to limit your intake, resorting to drinking very high beverages of high percentages of alcohol, those are indicators of alcohol abuse. Prioritizing alcohol even when you could have other pressing issues. Whenever you have money, you just have to part away something for alcohol and still remain with the necessary issues unattended to. Those also could be signs of alcohol abuse. And even resorting to drinking whenever you are pressed with issues, the first thing that comes to your mind is drinking. That also amounts to drug abuse. Drinking daily and not occasionally, it amounts to alcohol abuse. So all those situations would amount to drug abuse.
Okay, interesting stuff there. Now on alcohol, you've talked of one not limiting their intake. What is the acceptable intake? 12 bottles?
Okay. So with alcohol, sometimes you find the clinicians who recommend it in forms of pints, units, and stuff. And in simple terms, the other recommendation that exists is that for a male adult, it's recommended that they drink occasionally for those that drink, because it's not a must. For those that do not drink, it's fine. Then for those that drink, it's recommended that you drink occasionally. And apart from drinking occasionally, you drink 4 or less bottles of a normal alcoholic beverage. With females, it's recommended 3 or less, because with females, I think it has been observed biologically, they seem to be a little disadvantaged in terms of their tolerance levels of alcohol. We do get to have deliberate programs that are aimed at interacting with women. For example, we get to have programs sometimes with Ministry of Health where we go to clinics on days such as antenatal days and even under 5, where we target a number of women. And even through women gatherings, we are able to reach out to them and educate them on issues relating to drug and substance abuse. And through churches as well, we get to have groups of women that we interact with, and we educate them, and also make mention that we have services such as drug testing and counseling for those that feel they could be in need of our help, as them being hooked already to substances and failing to quit on their own. We mention the services that we provide. And besides that, we also have programs for them under family and parenting skills, which also targets men, where we educate them in a number of sessions on the ideal parenting techniques. And in that package, one of the topics that exists is being a good model to children. And under that, issues of bad behavior and all that are addressed, so that we help the women to be good models in society and even to their children, because most of the time they are caregivers.
Thank you very much, Nancy. Well, our dear viewers, if you're just joining us on the Lens today from the Ndola studio, we are looking at drug and substance abuse amongst the citizenry. And to help me discuss that issue in the studio, I have Nancy Maboshe from the Drug Enforcement Commission. Now, Nancy has just been running us through drug abuse, what it is, what it entails. I have seen, Nancy, that you have decorated our table here with some stuff. I would like to find out, what are some of the commonly abused drugs in Zambia? Maybe you can also run us through what we have here.
Okay, so among the commonly abused drugs, we have drugs like cannabis, which is actually the most notorious because it's locally produced. And apart from cannabis itself, although we get to have even the other type which comes from outside, the one which is very high in THC, the one they are calling cheese on the street. And apart from cannabis, we have drugs like cocaine, heroin, we also have cat or mirror, and we also have controlled drugs. So on our table here, we have samples. This one is cannabis. The one that has different names in our local languages. The Lozis will call it matokwani, others will call it mbanje, the Lambas call it urubangula. And even in the streets, there are different names. So here I have cannabis with me. The common cannabis, the ordinary cannabis, and which we find locally here. And then we also have the high grade one, which is the more of the organic one, the cheese. So this one is among the commonly abused drugs. Then apart from that, we also have drugs like cocaine. This is powdered cocaine, and this Roxy is crack cocaine. It's among the commonly abused drugs in Zambia, the powdered cocaine and the crack cocaine. Then apart from this, I also have samples of controlled drugs, those we call prescription drugs. Among them, we have Aten or Benzasco, the one they call in short form BH5, which has been trending, especially among learners, where we find grade 8, grade 6, we are receiving even such grades for counseling. So this is Benzasco or BH5, which is one of the prescription drugs. And apart from that, we also have the diazepam, and which they mostly call Bromash in the streets. This one is also among the commonly abused drugs. Then apart from this one, we also have a cough syrup, which has been common lately, especially among youths in tertiary education, in colleges, universities. We actually have been arresting a lot of them due to the abuse of this or supply of this. So this is bending with codeine in it, which is one of the controlled drugs, and we are not allowed to use it unless under a prescription or a clinician gives us. So this one has been among the trending drugs, and in the streets there you'll find youths calling it if in like on the copper belt, yeah. Then apart from that, we also have the legal substances like tobacco. There's a tobacco cigarette here, and there's the traditional snort, the so-called insunku. We find that these also are among the commonly abused drugs. And as this, we educate people on the dangers of this, because we know that these also are drugs, and people are at a risk of so many issues, because the World Health Organization tells us actually that tobacco abuse is among the leading causes of death. So we educate members of the public on this so that they make informed decisions. Then apart from that, alcohol also has been among the commonly abused drugs. It's actually a nuisance to some extent, in the sense that you find that even when adults are allowed to drink, but there's a lot of abuse of alcohol. So as Drug Enforcement Commission, we talk about it because of the effects that lies in alcohol abuse, and also it being a substance that is also a gateway to the abuse of other substances, because many of the times that you find that people that abuse alcohol also begin to try out other things like cannabis, codeine, and other drugs. So we talk about alcohol, and also because alcohol is linked to so many other ills in our society. So this also has been one of the commonly abused substances currently.
Okay, Nancy, quite a variety of substances on this table here. How rampant is drug abuse in our country? Can we say we are on top of things as DEC, it's controlled, or are we under threat?
Okay, so drug and substance abuse has been a growing trend, and each year we record a lot of arrests due to drug and substance abuse. Even drug trafficking itself, you find that it has been a trend that is actually amongst us, because people want to make quick money. So it's actually something that has been growing due to different factors, and we notice even a situation where we are even recording very young clients in our counseling department, and sometimes even through arrests. There are times that we have apprehended among adults. We find there's even a child there. So it's something that is
what ages are we looking at when you say we are recording children or young adults? Probably how young is the youngest?
So when we talk of counseling, we get to have clients even as young as 11, 10 due to abuse. Although we would say the most affected population is between 12 and 35.
Okay.
Yes, 12 and 35, these are the most affected populations. Yeah. So it's still a concern. Every week we are receiving clients for counseling through schools, through families, which shows that it's still a concern. And even as we observe in the streets, we see a lot of abuse, yes.
Okay. So from your interactions with your clients, You've talked of women, you've talked of men, adults, with regards to alcohol, you've talked of children. Now, from your interactions with these clients that you counsel, what would you say is the leading cause of drug and substance abuse amongst the diverse age ranges?
Okay, so there are so many factors that are actually contributing to these clients abusing drugs. In our education, in our counseling department, I think one thing that comes out most is a child's background, where they come from a family where there is some breakdown of some kind in terms of their parenting or them being raised. So that is also one of the causes. When we talk of poor parenting, you find that it's one of the contributing factors of people indulging in drugs, and this sometimes comes through different issues, maybe divorce, and a child is made to live with one parent who probably doesn't manage well due to a number of demands. Sometimes parents, you find they are very busy, and most of the time you find youths or children are left alone, so that's also a recipe for them abusing. And among other factors contributing to drug abuse, issues of boredom, others they abuse because they have nothing to do. Then others, you find that there is no proper guidance and mentorship, where there are families that may quite right be providing everything, but they give the children money and stuff to a point where the children sometimes end up misusing that. Then apart from that, others, they use drugs as a way of coping with traumatic issues they have gone through, coping with stress. They indulge in drugs or over drinking alcohol. Then apart from that, lack of recreational facilities. You find that our youth sometimes are enticing these things because there are no recreational activities around. You find that those that could be existing, sometimes you have to spend something to access them. Then apart from that, even issues of peer pressure, which is common, especially among the adolescents, and you find that among the males, it's common that when they reach this age of adolescence, there's some sort of a sense of obligation to try out some of these drugs or substances we are talking about. They feel when every man around, elderly man, try them out, and that's how you become man enough, which is not true. Then besides that, in schools, there are still myths existing, like when you abuse drugs like cannabis, you abuse these energy drinks that have very high caffeine, then you'll be enhancing your IQ and you'll be passing, which is not true. Then people also abuse drugs to enhance their performance. You find that there are people who abuse drugs like cannabis, and they claim that's when they work long hours without getting tired, which we do not deny, because in some people cannabis, it's a stimulant, it treats them as a stimulant. And apart from that, people abuse just for leisure. Then we have also observed a lot of disguised and explicit advocates for drug abuse, a lot of messages going around that glorify drug abuse, and you find that these come through fashion, where some clothes seem to send the wrong message, encouraging our youth to abuse. You find a nice t-shirt with a face and a big cigar there. You find people putting up stickers of some of these prohibited stuff. And even in songs, we are noticing a lot of songs that glorify drug abuse. And as youths listen to such, it's getting in them like the culture of drug abuse is something cool. If anything, those that are sober seem like they are the ones that are weird. So there's this new trend that our youths are seemingly beginning to adapt, yeah. So all these factors are contributing to drug and substance abuse.
Okay, now Nancy, today is Eve Christmas, and it has been observed that there's a lot of drug and substance abuse, especially among youths during festival periods or seasons like this one. What is your position as DEC?
Okay, so our position as DEC is that we are still working normally, and we encourage members of the public to safeguard themselves.
Do we agree as DEC that during this festival period there's some increment in this vice?
Yes, there's actually a lot of increase in terms of drug and alcohol abuse during festival season, and mostly due to the urge to celebrate. People want to celebrate, they want to have that leisure. So we find most of the people tend to think that without intoxicating themselves, then the leisure isn't enough. So we find that away from the eating and other activities that go on during festival season, people plan to actually intoxicate themselves during this season. You find even young ones, we have received concerns in some of the communities as we interact with members of the public, that young ones even save money throughout the year to just drink, yes, to just come and drink. They buy alcohol, they buy whatever, and they put that money together, yes, to intoxicate themselves. So because of the leisure factor, during festival season we record a lot of drug and substance abuse, and because the suppliers know that when people flood those pubs, the nightclubs and stuff, there's also market for the prohibited drugs. So I find that even traffickers, they are busy, they get to be so busy supplying. So during this season, you find that so much actually goes on in terms of drug and substance abuse. It's actually on the increase, yeah.
Okay, Nancy, another issue that is so predominant during the festival season is the rise in the gangs. For example, here in Ndola, how do you treat such? We have gangs in Pamozi, we have gangs in Chifubu, and also quite a number in Masala.
Okay, so among our targets that we get to have, and specifically under the Anti-Drug Operations Department, they have a target of dismantling the drug cartels that are existing, apart from also just arresting these that abuse, even if they are not belonging in any cartel. So you find that among these cartels we have the gangs themselves, because in most, if not all those gangs, one of the things that also exists is drug and substance abuse, because this is something they use to alter their perception, to make themselves fearless, aggressive, even as they do all those atrocities they are doing in society. So as DEC, we have keen interest, and we have been involved in actually arresting the members of these gangs. Then apart from that, even our sister institution, which is Zambia Police, they are on the ground to dismantle these. We so far we have had like the famous Tokota, which was dismantled here in Ndola. I think we had the 427, something like that. And we have keen interest in those, because indeed gangs are growing. Here in Ndola we are hearing of so many of them, the black dogs, the team mafias, and the gorillas, all those. So we are there as DEC to try and bring sanity, and we will continue to do so. And we encourage those members to seek help, because some of them affiliate to those groups merely because of their addiction to drugs, because that's where they are guaranteed of a sustained supply, because drug abuse is an expensive lifestyle. So we encourage people to seek help here, even as we do our work as DEC, because we have both the friendly and the other punitive face. As much as we want to enlighten or educate or rehabilitate as many as possible, we also want to arrest as many as possible to try and bring sanity. So yeah, we are on the ground.
What are some of the effects of drug abuse?
Drug abuse has a number of effects, and among them we have an issue of addiction. you find that these drugs, they are psychoactive in nature. There is a way that they affect the mind. There is a way that they reprogram the mind. So you find that people may begin abusing due to whatever reasons, whether it's enhancing performance, maybe they are in the entertainment industry, before they perform, they intoxicate themselves while they do whatever they are performing. But you find that it gets beyond that. Personally, I actually look at drugs to be a bait, something that attracts you to something bad. There will always be a price to pay. And usually I use an illustration of the way fishermen go fishing and they put probably a worm on the hook, or it's more fish to attract a bigger one. So I find that drugs are like that also. People are enticed by those small, the immediate effects, feeling high, feeling energetic, or fitting in a social group. But I find that drugs are like a bait. Beyond that, much is the price to pay. You find that among them we have addiction, where something that begins as something that you just do out of play or leisure becomes serious business, where you become physically and psychologically dependent. And at that point, you find that people are unable to stay without the drug, without drinking. Then that also comes along with a lot of other effects, such as substance-induced mental disorders, where today hospitals are recording a lot of people that are developing mental disorders due to substance abuse, where we find others, there isn't even mental illness running in their family, but they develop such disorders due to substance abuse. Then apart from that, even ill conditions like the liver cirrhosis, the being at risk of heart diseases, the lung cancer, chronic swelling. So there are actually a number of effects that can come as a result of drug abuse, and sometimes even just death, where a person reaches a point where the body can't take it anymore, and you just find they drop dead, or they are just found dead due to drug abuse. And it's also an expensive lifestyle, and you find you will not be able to do anything productive because much of your money will just be going to sustaining that lifestyle. And besides these ill effects, drugs are also linked to so many other ills in our society. You find that during festival season, we hear a lot of casualties, couples beating each other, gender-based violence after drinking spree, accidents, and also people making uninformed decisions. You find that when people are in those states of being intoxicated, sometimes they are able to even hook up with people where they don't indulge in protected sex, putting themselves at risks of infections. And even for those that are infected, you find that drug and substance abuse also compromises their adherence to their medication, and it compromises their health. So it's linked to so many ills.
Well said, Nancy. Now, in case there's someone out there, there's a youth out there who is saying, enough of this, I want to change my lifestyle, I'm no longer interested in this path anymore, and they want to access your services, but there's that fear in them, Dec. How user-friendly is Dec, and how punitive are you at the same time?
Okay, so Dec is very user-friendly, and we are as user-friendly as punitive as we are. So what I mean is we have both the friendly and the unfriendly phase. But when it comes to seeking help, we are very friendly. There is nothing like we change our stance where you come for help and then we say no, we will now resort to ARIS. No, we don't do that. And in terms of rehabilitating people, it's actually an official service that we offer. It's not a favor that we offer to members of the public. And we have targets there. We strive to help restore the well-being of a person, to wen off a person from whatever drug they could be abusing. Where we fall short in our services, because as DEC, we do not yet have a rehabilitation center where we can probably get to admit and confine those that are severe, even as treatment goes on, counseling goes on. we work with Ministry of Health, like Ndola, we work with Ndola Teaching Hospital, where we are able to reach those of our clients who, upon screening, we discover that they need intensive intervention, just apart from the drug counseling, the drug testings, we refer them there. So we are very friendly, there's nothing to fear. Counseling is not about any cohesiveness, it's about a friendly, consented, and a professional way of trying to rehabilitate or restore the well-being of a person. Yeah, so we are very friendly, and we encourage people to come forth for help, those that are battling with drug and substance abuse. For those who are not battling with it, but they have started abusing, the earlier you quit, the better, because drug addiction is a complex condition, very complex actually, to a point where you find that some people, even after they have been through counseling, they have been through treatment at the hospital, you find that some even relapse, they start abusing again. So the better is to quit before it gets too late. And for those that are not yet in it, especially our youths, the best is to stay away than hook yourself to something that will complicate your life.
Thank you very much, Nancy. As we come to the end of our program, today is Eve Christmas, and I'm sure if you and I take a drive within the city, maybe around 21, 22, 23, in most of these pubs, we'll find very interesting age ranges patronizing those places. What is your word of advice to our viewers, to the people out there, as we commemorate Christmas Day tomorrow, as we commemorate Eve Day tonight, and just this festive period?
Okay, so my advice to members of the public is that we need to be law-abiding citizens. Even with the festival season, we are still required to be responsible citizens, and we should be aware that law enforcers are actually on the ground. We intensify our operations, our presence during this period, knowing that there's a lot of criminal activity. So my advice is that let's safeguard ourselves and be law-abiding citizens. To our guardians, parents there, please, you still reserve the right to monitor your children or people under your care even through this festival season, because it is through periods such as this that we get to have a lot of casualties. Let's celebrate in a responsible way, because if we celebrate loosely and overindulge in these issues, we may end up being casualties to a point where some of us may end up not even crossing over into 2025. So we need to keep ourselves safe. To the women, girls there, let's keep ourselves safe. Sometimes we are victims because of putting ourselves in awkward places and indulging in these things where we end up failing to protect ourselves, and you find that we are violated sexually and stuff. So let's celebrate responsibly. Let's celebrate from places where there's safety and in a proper manner that will still foster our development. Besides, there's still life under beyond celebration, and we will still need the resources and the finances. So let's not overdrink. Yes, yeah.
Thank you very much, Nancy. It has been a pleasure hosting you on The Lens. Well, our dear viewers, we have come to the end of The Lens today. We have been looking at drug and substance abuse, and we had Nancy Maboshe from the Drug Enforcement Commission here in Ndola, and her advice to you, our viewers, today as we are celebrating Eve Christmas, tomorrow as we celebrate Christmas Day, and just as we count down to 2025, her advice is that let us celebrate in a responsible manner. Let us avoid the vices that will bring dangers to our lives. To the girl child out there, the future is female. We want to thank you for having joined us on The Lens. From Ndola Studio, I'm your host, Penelope Chansa. Nancy, it has been a pleasure hosting you.